When I started here in 1988, it was me and my partner at the time, and we sort of did primary eye care. We came here when it was a one-horse town, probably 20,000 people. Now there's over 110,000 people. So we've had a lot of growth. We've seen a lot of changes occur in the last 30 years. And as the city grew, I realized that there were a lot of other things that we needed to be doing. We needed to provide 24-hour service. We needed to be able to provide pediatric care. We needed to provide more geriatric care. We needed to do a better job of taking care of people and families. And it doesn't take a whole lot to be significantly better than what patients are putting up with when they go to their medical doctors, and they see their dentist, and they get put on hold, they get the runaround. People aren't supporting their insurance. The patients always comment when they call here, they get a live person who can answer their questions. We have 24-hour coverage for emergencies, but we're basically here to see patients same day, next day. When patients need to be here, we need to be here also.
Dr. Lewis is always looking for the next thing that we can do to enhance the practice and enhance our patient care here. So we get new technology, we try new treatments. He's not afraid to try new things if we think that it will be helpful for the patients.
A lot of the newer technology that have become available in the last 10 years have really revolutionized the eye exam.
Some of these new technologies are so state-of-the-art and so cutting edge that they're actually allowing us to diagnose and treat many, many years before some of these diseases are being caught.
A lot of the equipment is used by the technicians prior to seeing the doctor. So when the patient gets in to see the doctor has on the monitors all of this data at their fingertips, and we can review these things with the patient. We can show them the shape of their eye. We can show them what their glands look like that produce the lubrication to lubricate the front of the eye. We can show them what their retina looks like. We can show them why we know they don't have glaucoma. We can show them, here are the things we need to watch.
It's not a one-size-fits-all. Every patient has a different need, and they use their vision in different ways.
We see veterans, we see a lot of kids. We're doing a lot more vision training, a lot more pediatric specialty type work now. And those are things that most single doctors, single offices can't provide, because those are things you really can't dabble in.
Our main focus is making sure that kids are seeing what they need to be seeing appropriately. That way they can be successful in the academic setting and in life. Similar to how a pediatrician is checking different developmental milestones with motor, we do the same thing with the eyes. So the ability of the eyes to tract, being able to transition the focus, making sure they're processing what they should be processing the appropriate way.
As we've grown to a 4-doctor practice, we can each kind of specifically do the things that we need to do to expand the scope of what we do in the practice.
Contact lenses are constantly evolving. Technology, again, is being implemented in ways that have changed drastically just, again, in the last 5 years. But specialty lenses are a little bit different. They're for those patients who don't quite get to see clearly in an average lens.
Seniors, as they go through life, there are anticipated things that are going to come up. We kind of know when their cataracts are coming around. We know they have a family history of macular degeneration. We know what they're at risk for, and so we now have the new technology to find out, well, what are the things we need to be watching to make sure that you're still seeing well on into your 80s, 90s to 100 years old.
Dry eyes, eye fatigue, any eye diseases that they have, we want to make sure we're finding those early and treating them, and most of all educating our patients about them so that they understand what's going on with their care.
We warranty all our products for 2 years, that's including the frames. We have discounts for patients that unfortunately don't have vision insurance. We do give them a 20% discount off of everything. We do have also a second pair, multi-pair discount. We also do honor a military discount of 30% for active duty and retired military.
We also have incorporated patient portals, so they can actually view all of their patient information and directly communicate with each individual doctor as well as the staff here in the office.
We're really trying to do a great job of education on the patient, and then we have to back that up with the proper instrumentation, the proper expertise, and the right doctor to do the right job at the right time.
Dr. Lewis was amazing and was very thorough in his explanation of my eyes and how the eye all works.
We want to have the highest quality, the best service, the best technology.
From beginning to end, the staff was very friendly and professional and took very good care of me.
We really are different. I guess we really do something totally different than what most people are experiencing. Good job, good job.